wanted to come here today because I am very upset at the thought that the Affordable Care Act could be kicked out. It's helped so many people, particularly in my family.
We need to fix the problems and go forward.
The Affordable Care Act has its flaws like every other bill, every other law, but the fact is that there's nothing else to replace it with, and people need it in order to survive.
Senator Susan Collins' office here in Portland, Maine isn't the only one that's going to be seeing an uptick in visitors. Activists say they have more than 75 speakouts or protests planned this week as members of Congress return to their home districts for the recess.
They should not blindly try to do away with Obamacare, but they should work on improving it. I admit it's got problems. Costs are going up, there's no question about that, but the answer is not throwing it out.
So I need Medicare to maintain. In 1997, my husband, ill of cancer, we went bankrupt before he died. So we lost everything, every single thing, because medical and medically related bills in 1997. I want really Medicare for everyone. But if we can just keep the Affordable Care Act and tweak it, that will be the case.
People need it for treatment, for things like, like cancer, diabetes, anything else. Those kind of chronic illnesses need something to be covered with.
I had a younger sister who died 20 years ago from breast cancer that was not diagnosed until she was on her deathbed because she had no insurance and never went to a doctor. More recently, my brother, who is self-employed and had no health insurance, had major back surgery. He fortunately had the back problem after the Affordable Care Act was available, and he was able to get insurance before the surgery.
It does a lot of good things. It keeps kids on their parents' plans until they're 26. It prevents insurance agencies from getting rid of people who have pre-existing conditions or not accepting them with a pre-existing condition.
Both my mom and I suffer from some chronic illnesses that need, monitoring, and we go to New York for doctors and stuff like that. The only way we can afford to do that and keep up treatment is through the ACA.
I've been lucky. I have insurance. I've always had good insurance, but my close relatives have not been that lucky. And if we do away with the Affordable Care Act, and if Medicare or Medicaid are reduced, other members of my family and friends will have a terrible time trying to deal with their health problems.